This is the Leo Climaco podcast.
It's also like a normal child, hysterical crying.
Absolutely.
Yeah.
Absolutely.
There's no consciousness there.
Absolutely.
They're just in pure terror, pure panic mode, pure survival mode.
Absolutely.
Yeah.
That's exactly.
Now
exactly.
add autism to the mix.
Exactly. So it's interesting because you're actually taught to use less words. And I think that's something that we do with our kids, if you think about it. Because when you're in a state of panic, they're not hearing you.
Right.
So you don't want to continue to
ramble, right?
You know, give directions and say all these things because then
Right.
everyone's just talking.
Right.
So it's really trying
It's,
to
hey,
find a
I'm
place.
here. Connect, you and me.
Yeah.
Hear my voice.
So we actually say, you know, there's one person who's going to talk.
Makes sense.
And usually that person was me.
The negotiator.
But
That makes sense.
sometimes,
Yeah.
you know, if another person was by the head, you know, I would give that person the permission to say, you know, hey, like once we're on the floor and he was calm, he would say, like, get off of me, basically.
Right.
And we would say, you know, your body isn't calm. You're not being safe. We can't let you go. So once he was able to acknowledge, once we saw that he came back and understood, like, okay, now I can be safe,
Right.
then, okay, I'm going to let go of your legs. And if we saw that his legs weren't kicking and he was actually calm, cool. Now let go of your arms.
Step by step.
Step by step. Okay, hey, now you're free. Do you need some water? The staff would go take a break. Everyone takes a break because everyone's in
Yeah.
a heightened state.
Yeah.
And that happened daily for quite some time.
Wow.
Yeah. So
These poor parents.
it's rough.
Yeah, it's rough.
It's rough. Yeah.
I think about our friend of the family who has two boys that are in a clinic,
Yeah.
and they are just very severe,
Yeah.
very, very severe.
Yeah.
How do you know that cutoff from he's okay to live at home or he's not okay to live at home anymore?
It's a great question. It's a great question.
You know what I mean? Like,
Yeah.
what's that cutoff of
Yeah.
of danger, of security, of no progress can be made here?
Right.
You know what I mean? Unfortunately.
There's a lot. The biggest thing that I always say is safety. You know, we have that. We have that in behaviors. We have some families that have older, aggressive children, you know, 18, 21,
Yeah.
that have come to me with that question. And the answer is safety. Can you physically handle your own child? Are you safe?
Is he safe?
Is he safe?
Right.
You know, and if the answer is no, then you have to make that decision. You
Right.
have to make the decision of, okay, you know, it can go two routes. Do you want to have live-in help?
I was gonna ask you, is there a half step?
There is. Do you want help? Do you want someone to come in?
I can see that being a solution for most.
Possibility.
Yeah.
It's a possibility. Or then you send your child to a residential facility,
Right.
which is an option. But it's a very, very hard conversation and a hard choice to have.
Oh, extremely.
Because you're sending your baby, you're sending
Yeah.
your child
Yeah.
away.
Away from you, no longer in your care, no longer in your control, no longer in your environment. Now they're in a clinic, it's sterile, there's
And
doctors
they may
and
not
nurses.
understand why.
Yeah.
that's happening.
Right.
Why am I not home? Why am I not with mom?
Right.
And they may never understand that. And that's a whole nother level for the parent to grieve
Right.
and deal with. And I've had some very, very hard conversations with parents. And we've actually currently saved a child from going to a residential facility because he was close. It was a recommendation that was made for him.
By a doctor?
No, by a other therapy agency.
Okay.
That wasn't able to
Deal
make
with him.
progress with him. And luckily, with parent training, with staff that we were able to implement, he's making good progress and he's at home. But it's
That's great.
Really,
Congrats.
Thank you. It's really our staff. It's really, it's really huge.
But you're also an awesome leader.
Thank you. I appreciate that. But it's really, it's the choice of staff. It's the BCBAs that we choose. It's that structure that we put in place. But it's that parent training piece that really is huge. That sometimes is missing. That parents don't really may not find the value in. B, may not accept, or C, unfortunately not follow through with. And then that's a whole nother conversation because then it gets to the point where if you're not accepting our help, then you're
jeopardizing everything.
Kinda, yeah.
Have you ever thought about starting a parents counseling group?
Yes. Yeah. It's funny because one of our BCBAs actually just reached out to me about doing some kind of group training.
For the parents?
For the parents.
Do they need training or do they need more emotional support?
I think it's both.
Yeah.
I think it's really, it could just be putting it out there, saying, hey, these are the things that are available to you and kind of seeing what catches.
Yeah.
And kind of seeing what they're interested in because they may not even know that that's an option for them.
Right.
It's a lot of work and it's a lot of pressure on the parents.
It is.
And it's a lot of seclusion and it's a lot of
accepting.
It's a lot of accepting or not accepting or, loneliness or, unfortunately, embarrassment.
That's right.
There's a lot of grief in special needs. There's a lot of parents that I meet that I didn't realize go to therapy because they're grieving the child that they didn't have.
Right.
The child that they, that normal, quote unquote, normal child.
The child they'll never be, right?
Correct. But there's beauty in that too.
For sure.
That they grieved, that they went to therapy and they've accepted.
Sure. Yeah.
And now they can support their child.
And that doesn't mean they don't love their child.
No, not
it just
at all.
means that they have to deal with this to be able to fully be there for their child, to really accept who they are.
I think if anything, they love their child more that way.
100%. They're more open.
Because they're more open, they're more accepting.
Yeah.
They have space now to do the work.
Right.
To get their child to therapy.
Right.
And that's how the child gets to us. They've moved past okay, there's an issue here, and now I can go and get the
and
speech,
resolve it. Right.
The occupational therapy, the physical therapy, the
ABA,
all the needs.
Yeah.
And kids make huge progress, huge. And luckily, we're able to. We have clients that have been with us 4 years since the very beginning. We've had clients that 7 years now that just are with us, and we're able to support them and support their families, and it's beautiful.